Hi, I'm Dr. Zona from the Zona Profiles. Today we're going to be talking about sleep hygiene. Sounds a little funny. Sleep hygiene basically means good sleep habits. And it's amazing because I have so many patients that have been helped. It's probably the most significant thing I can do to help a patient. It's not something that they teach in residency. It's something I've had to learn on my own. If you want to do your own investigation, just wiki sleep hygiene. Or Google it and hit the wiki page, and wiki and the 3 or 4 references that wiki will send you to are excellent and will give you an extra amount of information over and above what I'm explaining here. There are so many symptoms that affect sleep: depression, anxiety, chronic pain syndromes, drug and alcohol states, especially detox states, psychosis, mania, and hormonal imbalances, to name a few. But there are just hundreds of medical illnesses that create problems with sleep. This sleep hygiene is a system, a behavioral system. And what's great about it is you learn the techniques. You learn how to effectively control your own life. There are no side effects to this technique. There are no co-pays, there are no deductibles, there are no morning hangovers. The good thing about the sleep hygiene system is that there are no side effects to the medication. The patient has complete control over it, it's natural, and you don't develop a tolerance. This is a behavioral system, and the more you practice it, the better you'll feel. And lastly, unlike other medications, there's no morning hangover. If you're practicing sleep hygiene properly, you're going to wake up feeling rested with no medication morning hangover. Now, this behavioral system, or this sleep hygiene that we're going to talk about, it's basically a system or a list of do's and don'ts, and I'll explain the rationale behind them. But the advantage is you don't have to use the entire system. You can pick and choose what things you want to use to help you when you want to use them. And the more you practice them, the better you get. Remember, this is easy, it's free, there's no side effects, so why not give it a try? So what I'm going to do is talk about sleep hygiene and break it up in terms of waking up in the morning, your daytime, your evening, and the actual sleep. Break it up into 4 different parts so that you have a temporal understanding over the course of the day of how to engage in this system. Okay, firstly, the morning, waking up. This is going to sound a little weird because when you're not sleeping well and you finally get to bed at 4 a.m., you're, oh boy, I need to get my sleep, I need to sleep in. Well, that's not what this system is. With this system, you are going to wake up the same time every day, irrespective of how much sleep you received the night before. For example, if you went to bed at 1 in the morning and you typically wake up at 7 a.m., that's 6 hours. Most people, if they can finally fall asleep, are so relieved they actually sleep past their ordinary wake-up time. But with this system, you have to wake up the same exact time every day. Didn't get to sleep the night before, only fell asleep at 4:30, well, 7 a.m., if that's your time you wake up, 7 a.m. rolls around, you wake up. Yes, you will be dragging the first day. You will be tired, you will be fatigued, you will have daytime somnolence. But that evening, when the evening rolls around, you're going to be exhausted, you're going to fall asleep much more readily, and that's what you want. You want to be able to fall asleep that night and wake up. Let's talk about the do's and don'ts for the daytime. If you drink caffeine, that's fine. Drink caffeine, enjoy. It helps you focus, it helps you pay attention. But after 12 o'clock, later on, maybe after 3 p.m., once you get the system down and you're sleeping better. But after 12 o'clock, no caffeine. A lot of people say, oh, it doesn't touch me. I can make a pot of coffee at 7 p.m. and still I sleep or don't sleep independent of whether I drank coffee that night. Well, that might be, but for the purposes of this program, give this system a try and see if you can help yourself. At noon, you stop having caffeine. That includes chocolate, tea, coffee. Here's a big one, no naps. I know if you fall asleep at 3 in the morning and you wake up at 6 or 7 a.m., you're exhausted, you have daytime somnolence, that 20-minute nap helps tremendously. Again, we're using a program and we're being really strict with ourselves for the purposes of trying to find some help and comfort here. So for starters, there are no naps through the day. Keep exposed to natural lights. This helps your cycle. If you're exposed to outdoor lights, and this is not the fluorescent or incandescent lights you find in a large office space. This is outdoor lights. Expose yourself to outdoor lights. It will help regulate your sleep cycle. If you have to, go outside for lunch, even if you're going out for 10 minutes to eat your sandwich, or if you're walking from your car back to your office, spend a little time, dally a bit, get some outdoor exposure. Ideally, exercise in the day would be great outside. That will help you with insomnia tremendously. People who exercise routinely sleep better in the evening, have less problems with insomnia. Also, one thing to consider in the day is what medications are you taking? Does your doctor have you on a medication that could cause insomnia? A lot of serotonergic reuptake inhibitors, big word, but that's like Paxil, Prozac, Celexa, Lexapro. Those are a lot of antidepressants. Those can keep you awake and cause insomnia. And there's a lot of even paradoxical effects. If you're not sure, make a list of your medications, sit down in front of the computer and Google it. And you'll find out soon enough whether or not one of the common side effects is insomnia. In the evening, it's helpful to have a ritual. You want to settle in, avoid strong emotional issues, arguments, so on, right before you fall asleep or go to bed. You want to avoid heavy exercise. Some stretching might be good, but you don't want to have a high body temperature as you're trying to fall asleep. So no running 3 miles before you fall asleep. That's not going to work. You actually want your body temperature to come lower. There is a concept that a hot bath will help you. Well, a hot bath might relax you, but if it increases your body temperature, it's not going to help you fall asleep. Ideally, where you're sleeping should have a cool ambient temperature, not too hot, not too cold. Cool is the best sleeping temperature. Avoid alcohol. Yes, a beer or two or a drink, a nightcap, might help you fall asleep. That's known to be the case. But alcohol does not help you maintain sleep. In fact, alcohol disturbs your sleep, and oftentimes you'll wake up in the middle of the night as the alcohol starts wearing off. If you're drinking high volumes of alcohol at night to fall asleep, well, certainly you're going to be waking up in the middle of the night to go to the bathroom. So you want to avoid alcohol. Even though it may help with initiating sleep, it's not good for the totality of sleep, and it's not good for insomnia. What foods might help? Well, let's start with what you should avoid. You want to avoid heavy, spicy foods in the evening, as well as heavy dishes or a sense of fullness in the stomach before you lie down. If you have to eat, have small snacks. You might want to consider a turkey sandwich, granola, or a banana, which have higher tryptophan levels. And tryptophan is an amino acid that helps you sleep. Now let's talk about your bed. Your bed, of course, should be comfortable, and again, cool temperatures. Some people prefer some white noise. You can purchase a white noise maker, something like a fan even, can help with some distracting sounds. But basically, your bed should be used for sleep or sex. That's the only thing you should be doing. It's amazing how many of my patients are watching television, eating, doing crossword puzzles, but they're doing it in bed. And what they're teaching themselves is they're teaching themselves that it's okay to be in bed and not sleeping. That's not what you want to do. You want to be able to lie down in bed and fall asleep within 15 minutes. You want to condition your body that sleep and the bed are the same thing. So you lie down and you try to go to sleep. You relax, you go to bed when you're sleepy, not at a designated time. If you can't fall asleep after 15 minutes, this is very important. You have to get out of bed. You do not toss and turn. If you do, you're just teaching yourself that lying in bed is okay. You don't need to fall asleep. You can just lie there. And that's not what sleep hygiene is about. If you cannot fall asleep within 15 minutes, you get out of the bed and you read, watch TV, play a computer game, do whatever you want. But you cannot fall asleep on a couch. You want to, or in an easy chair. You want to relax. You want to do some activity, some emotionally neutral activity until you're feeling sleepy again. Remember, go to bed when you're sleepy. No tossing and turning in the bed. Some people write their worries on a list and say, these are the things I'm concerned about. So they'll make a list, and then when they go to bed, their mind doesn't have to race. They don't have to start rehearsing all the things they have to do the next day. They can say, oh, as part of my evening ritual, I wrote down the issues that are going to be bothersome to me as I'm falling asleep. I wrote them down. They're there. I'll see them when I wake up in the morning. Try to cast it aside. Of course, it's helpful if your partner is compliant with your program. If you're just falling asleep and all of a sudden, your partner comes in and starts watching television in the bed, that's going to wake you up. So when you want to get with your partner and say, hey, I'm doing this new program, Sleep Hygiene, come check this out. It's on Wiki, check out these links, I need your help. Can you help me with this? This is what I'm going to do. What do you think, partner? What should I do here to help myself? Do you see anything that I'm not doing or have any other suggestions? So in conclusion, sleep hygiene is a system of do's and don'ts. The critical issues, in my opinion, are getting up the same time every day. That's tough, especially on the weekends. And when you're better, you might want to do away with that. Again, this is a flexible behavioral system that you can apply and choose to use what you want to use when you want to use it. But to start, the critical issues are getting up the same time every day, going to sleep only when you're tired, not tossing and turning in bed. If you are tired, get out of bed and do something else until you're tired, go back to bed. These are the critical issues. Then, of course, the kinds of things you're doing in the day. Exercise, sunshine, avoiding caffeine after 12 in the afternoon, and making sure some of the medications you're on aren't contributing to your insomnia. But at the beginning, try to stay real strict with yourself on all of these realms, your morning awakening, your daytime, your evening, and your actual in-bed time. And if you follow these behavioral systems, you'll be in the same category as 80% of my patients, which is moderate to very helped by using this simple system. This is Michael Zona from the Zona Profiles. Thank you for watching.